So types of economic evaluation. This is a very big table where I'm going to try to describe different types of economic evaluation out there, and just so you can familiarize with the terms and with the different concepts. So let's start from the really the basic economic evaluation, which is the cost minimization analysis. You will see that for each type of economic evaluation, you will have some indication about how costs are measured and valued, how that particular type of economic evaluation identify the consequences or the outcomes, how it measure or value the consequences or the outcomes, and also in the last column there is an example of what that that particular economic evaluation looks like. So in terms of cost minimization analysis, there's no consideration about the outcomes because there is an assumption that the outcomes are equally effective. So let's have a look at the example in the last column. In this particular example, we are comparing the cost of administering a therapy to treat hypertension using two alternative modes of delivery that are considered equally effective. One is in the hospital outpatient setting, and the second one is in private homes by involving community health staff. Now, this assumption that the two interventions are equally effective could be quite strong. It could be not really realistic in many cases. So that's the reason why cost minimization analysis are not really that common. They could be used in certain circumstances, but they're not really that common because of this strong assumption about the equal effectiveness of the interventions. Cost consequence analysis. Here we are really starting to consider the consequences, the outcomes a bit more. In particular, we are considering the outcomes in a disaggregated format. And let's have a look at the example and let's understand what we mean with the disaggregated format. So given that the assumption of equal effectiveness might not hold, we compare alternatives A and B in terms of cost, but also consequences. So things like acceptability, willingness to use, resource use, health outcomes. So all these outcomes are listed separately and we consider them separately. And then it's up to the decision maker to understand the relative importance of these outcomes. So they might think that willingness to use is more important than resource use. Okay, health outcomes are more important than willingness to use, and so on. So we just list all the outcomes separately. Cost effectiveness analysis, again, consideration of both costs and outcomes. But in this case, we are considering outcomes as a single effect of interest measured in natural units. So let's have a look at the example again in the last column. So we are comparing alternatives A and B in terms of cost and a single effect of interest, which is typically our primary outcome, measured by a reduction in blood pressure. So remember, the examples is really about hypertension. So the primary outcome will be something which is hypertension related, like, for example, reduction in blood pressure. And that is measured in natural units. With a cost utility analysis, which is a kind of a special case of a cost effectiveness analysis, we are still considering a single effect of interest, but is a kind of composite outcome. So cost effectiveness analysis, you got something which is clinical, could be reduction in blood pressure, or for example, cases of specific disease avoided and so on, avoided hospitalization as well. There's something clinical which could be related to the specific health or disease area. With cost utility analysis instead, we are trying to measure healthy years, which is a composite outcome which takes into consideration not only the quality of life, but also the quantity of life in a way. So not only how well we live, but also how long we live as a result of receiving a particular intervention. So let's have a look at the last column. Again, we got this comparison between alternatives A and B in terms of costs and a single composite outcome measured by healthy years, which means estimating the quality of life changes and life expectancy of hypertensive patients being treated. The difference between the cost effectiveness analysis and cost utility analysis usually lies in the way we measure the outcomes. And with cost utility analysis, we got this concept of healthy years, which really could be applied to a lot in different health or disease areas. While with cost effectiveness analysis, we focus on clinical outcomes which tend to be specific to that specific health area, like for example, hypertension. So they couldn't really be applied to other health areas with the same degree of relevance, let's say. On the contrary, health years can be applied to different health or disease areas. And that's why cost utility analysis is, for example, the method recommended by NICE, the National Institute for Healthcare Excellence, and is the gold standard, let's say, type of economic evaluation which health economists use in the UK. That doesn't mean it doesn't have any limitation, and we will explore this limitation in session 4. The last type of economic evaluation is cost-benefit analysis, where not only we are trying to monetize cost, which is what we would expect to do, but also we're trying to monetize outcomes. For example, we can see that in the last column, we're trying to measure cost consequences in monetary terms by estimating, for example, how much the treated patients will be willing to pay for the therapy. So whether they assign a specific monetary value to therapy 1 or to therapy B and so on. Now, trying to monetize outcomes is not always feasible, especially when you try to monetize something which is intangible, which doesn't have, for example, market value, okay? So cost-benefit analysis are used, but they are not as common as cost effectiveness and cost utility analysis.